female patient presented with a lump in the upper outer quadrant of right breast. The lump is very hyphakic as compared to fat. Margins are irregular. Microlobulations are pointed here. The lump is hard, but mobility is present. It is not fixed to the underlying structures. And here is a echogenic halo surrounding the lump. It represents spiky lesions. Lump shows enhanced sound transmission. High-grade invasive ductal carcinoma usually cause enhanced sound transmission. Color doppler shows neovascularity. Malignant lump usually fed by multiple vessels, where benign fibroadenoma usually have a single feeding vessel. Here multiple enlarged metastatic lymph nodes in right axilla. Lymph nodes are hyphakic. There is no central echogenic hilum. Multiple metastatic axillary lymph nodes. Here is a benign enlarged lymph node, shows central echogenic hilum, presence of transcapsular feeding arteries and metastatic lymph node. In the left side, the lump, malignant lump. Here is another lump with angular margins and microlobulations. A solitary enlarged metastatic lymph node. Doppler shows transcapsular feeding arteries. Here is a fibroadenoma. The lump is gently lobulated, elliptical in shape, a thin echogenic capsule. Doppler shows a feeding vessel from surrounding breast tissue. Here is the different images of malignant breast lump and benign fibroadenoma. Here metastatic lymph node and reactive lymph node. Thank you.